Okay.
Okay, I'm going to perform my hand hygiene. And then I'm going to put some gloves on. Hi, my name is Savannah. I'm going to be your nurse today. Can you tell me your name?
Chloe Patterson,
And can you tell me your date of birth?
11/29/00.
Okay, I'm just going to check your wristband. Perfect, that's her. Can you tell me where we are right now?
We are in Foster Hospital.
Okay, and can you tell me the date?
It is April 29th of 2021.
Perfect. So I inspected the patient as she walked in. She had a normal gait, no limping or anything like that. So now I'm going to go ahead and begin with your head to toe assessment. Is that okay?
Yes.
Okay. First, I'm going to inspect her scalp for any lesions, any abnormalities, or anything like that. Okay, perfect. Now I'm going to look at her face for any asymmetry. Can you raise your eyebrows for me and put them back down? Perfect. They raise at the same level, so they're symmetrical. I don't have my pen light, it broke, so I'm going to use this pen as an example. So I'm going to go ahead and check your eyes. So just look at me. Okay, eyes are perla. Next, I'm going to look at your ears. Oh, first, so you wear glasses, so I would mark that in my chart. Okay, I don't see any drainage in this ear. And no drainage in that ear. Her nose is centered. She doesn't have any deviated septum or anything like that. Can you open your mouth for me? Okay, perfect. There's no drainage. The back of her mucosa is nice and pink. I don't see any lesions or anything like that in there. Okay, I'm going to take your carotid pulse on both sides of your neck. Perfect. So she's +2 on both sides bilaterally. So I'm going to look at your trachea. It's in line with the rest of her face. It's centered. There's no bumps or anything like that. It's perfectly symmetrical. Okay, so next I'm going to move on to your arms and hands. I'm going to look at your arms first. So I don't see any lesions or anything like that. There's no drainage. I'm going to check to see her skin turgor. Okay, it bounces right back. Perfect. Can you point your hands down for me and point them up and give me a twirl and the other way? Awesome. And can you wiggle your fingers for me? Perfect. All right, so you're gonna push against my hands and then pull. Good. I'm gonna check for capillary refill in all of her fingers. Okay, capillary refill is good. It's filling within 1 to 2 seconds. So next I'm going to listen to your lung sounds, and then I'm going to listen to your heart sounds. So there'll be 6 on the front, 1 on each side, and 6 in the back.
Got it.
Okay, so lean back for me. Okay. Breathe in. Breathe out. 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 Breathe in. And breathe out. Okay, now I'm going to check on either side, so if you could lift up your arm for me. Breathe in. Breathe out. Okay. Breathe in. Breathe out. Perfect. And if you could turn for me so I can check your back. Okay. Breathe in. Breathe out. Breathe in. And out. In. Out. In. Out. In. out, in, out. Okay, perfect. So her lung sounds good. I don't hear any crackles or wheezing or anything like that. It's all normal. So next I'm going to go in and listen to your heart sounds. First I'm going to listen to your aortic, then I'm going to listen to your pulmonic, then I'm going to listen to Erb's point, then I'm going to listen to your tricuspid, and then your mitral. Okay. So first I come in for your aortic. Sounds good. Your pulmonic. Very strong. Erb's point. Good. Your tricuspid. And your mitral. Perfect. So her heart sounds are normal, very strong. Up next I'm going to inspect your legs. So just looking at her legs down here, the patient would normally be in a gown, and so I would be able to inspect more, but just for the sake of the video, we're going to take a look down here. Do you shave?
Yes.
Okay. But I do see a little bit of hair growth, so that means there is good circulation down here. I'm going to take your pedal pulse in both of your feet. Okay, feels good. Okay, so just looking at her skin, there's no abnormalities. It's the same color as the skin all over her body. There's no discoloration or anything like that. So next I'm going to test your strength. Can you push against my hands? And pull. Alright, can you point your toes down? And point them up. And give me a twirl. And the other way. Can you wiggle your toes for me? Perfect. Okay, so next I would lower the patient's bed down and have her side rails up. I would let her know where the call light is and let her know that the doctor will be in shortly, and if you need anything you can go ahead and let me know. Okay, thank you.
Thank you.